me sit proper. All right, welcome, Dr. Martinez. Thank you for allowing us to come into your space and really learn from your expertise. I know you've been a practicing doctor for so long now at this point.
It's been a few years, yeah, definitely.
And before we get into ketamine, I just want to ask you, what your background is in medicine.
Yep.
I personally know, but I want to know where you ended up, why you ended up
Sure.
there, and how ketamine became a part of that.
Got it. Yeah. So, I mean, I've been practicing medicine for about 15 years now, 15 plus or minus. I did my primary residency was in preventive medicine. It was preventive medicine, environmental medicine, occupational medicine. So it gave me a good background for, what we're doing now, right? I was always really interested in aging as a root cause of many diseases and as a cause of dysfunction. So I really became involved with longevity medicine, anti-aging medicine a while back. And also with regenerative medicine, like, the stem cells, PRP, and all these other novel therapies, right? And, ketamine, because when you do this sort of medicine, you're really addressing and treating patients in an integrated manner, right? It's really an integrative medicine. And ketamine, I followed it a while back when the early studies came out showing that the low-dose ketamine was helping patients with depression, with PTSD, with anxiety. So I was really an early adopter. I started doing IV ketamine quite a few years ago. And I was really, from the get-go, I was really impressed with the therapeutic benefits. I was seeing patients respond faster. Depression, patients with treatment-resistant depression, PTSD, you name it. I was having really good results. So I was like, this is going to be a mainstay of my practice, right? And so far, so good.
Yeah, so far, so good. Yeah, I love that. It's a really innovative way to use a substance and a tool we've had in medicine for quite some time.
Exactly. We've had ketamine, in our toolbox for many years. And it was mainly used in anesthesia, right, in the OR. So discovering that this old drug can be used in a different manner, in a very safe way, and we'll talk about that a bit later, but in a very safe way, and just produce these profound changes is really exciting.
Yeah.
So again, I use it frequently.
Yeah. And it's not only good for anxiety, depression, PTSD, but it actually does a lot of neuroregeneration, right?
Yeah, it's interesting. Great topic there. So there's some studies on how ketamine can actually activate certain repair responses, repair pathways in the brain. And I think that's still an area of research. But for example, there's studies showing that ketamine can activate certain pathways in a similar manner to some peptides.
Yeah.
Peptides is also a very interesting topic, right? And but ketamine, so besides its, I guess, neural reset or neural reprogramming capacity, ketamine can actually help with the repair response. So that's an area that I think it's understudied, and we'll probably get more data on that in the next few years.
Yeah, which is exciting to see.
It is.
Yeah. So just a little bit of background too, and this is kind of really stepping back into my pre-med days. But I remember sitting in my neuroscience class and seeing the brain of somebody who did face a lot of depression, anxiety, stress, and someone who doesn't. And one of the things that really stood out in the difference of their brains was the ability for those neurons to connect, because the synaptic bulbs and things were somewhat pruned, right?
Sure. So
when we're talking about the regeneration of neurons and cells and ketamine's ability to do that, do you think that that's why it's not only like treating depression and anxiety, or what is it elongating them, or like what is actually happening?
I mean, and again, I think it's still an area of research, right? But I think ketamine can actually help modulate certain growth factors in that space. So, we have the microenvironment, we have all these neurons there, and they can respond to different growth factors, like, for example, brain-derived growth factors, neurotrophic growth factor, BDNF, and others. And I think ketamine might be playing a role in modulating some of these growth factors, and thus enabling a better communication and response. Now,
got you. Okay, well, we have some Q&A coming. But before we get to that, there's kind of an elephant in the room
There is.
with recent news and things going on. And I know this is not the first case.
Sure.
But Matthew Perry
yeah.
recently, you know, passed away.
Yeah.
And when the news and the media reported it, a lot of it came back to the use of ketamine.
Yeah, and I think that was unfair. I think that was a bit of unfair reporting. And, you know, again, trying to maybe give ketamine a bad name. Matthew Perry, in his case in particular, we know a few things, right? We know he was addicted to substances. He had an issue with alcohol and multiple other drugs, right? And we also know that, I guess when they found him dead, he had multiple substances in his body, right? He had been abusing drugs. Among them ketamine, right? That was one of them. So I think it's important to understand, first of all, any of these medications, if you dose it high enough, you're going to have side effects.
Yeah.
So ketamine has side effects. The good news is when we use it in low dose ketamine protocols, it's extremely safe. Higher doses of ketamine can produce respiratory depression, can affect, you know, cardiovascular functioning and whatnot. But, you know, again, that really falls into the abuse category.
Yeah.
Where Matthew Perry was at. And also it really was synergistic. I mean, the effects were really related to all the other drugs and everything else that he was doing. So I think that to blame everything on ketamine for in that case is unfair. And it really takes it out of context because, again, therapeutically in these low doses, we can do a lot and then help our patients.
Yeah. Yeah. It is a fine line between medicine and poison.
And poison, exactly.
It's, yeah, elemental. At the end of the day, it comes down to the user.
I think, I'm not sure, don't quote me here, but I think it was Alfred Nobel, maybe, that said, you know, the dose makes the poison. And anything in sufficiently higher quantities can be detrimental to our health. So.
Yeah. Yeah. One of the main things that really stuck out to me in his particular case as well was the fact that this man had ketamine in his system and was also in a hot tub.
Yeah.
So let's talk a little bit about how not only like the dosage was off, but there were also other things. Yeah. And what's the word I want to use? Just an inappropriate use of it in the first place.
Totally. Yeah, it was definitely abused. And you know, ketamine can produce some effects like dissociative effects. You can feel a little drowsy, woozy, you can feel out of it, right? So it's really important to monitor the patient and do it in a safe manner. Obviously, when you're in that sort of scenario where you're partying out, you're dehydrated, you're full of drugs, you're in a hot tub, I mean, a lot of bad things can happen. And again, not necessarily specific to the ketamine, just like you said, the environment. So when we administer low dose ketamine to patients, we monitor them, we monitor their vitals, make sure they're fine. And after they finish the procedure, we give them some time to really recover. Yes, you've gone through this, you know how it goes. So we give them time for them to feel better. And we make sure that, you know, they don't drive back home. They're with someone else that can drive them. Yeah. So it's really a recovery process, but it's a very safe one. Yeah.
Yeah. When it is medically administered and supervised.
Correct.
Yeah. No. Just like anything else, I suppose.
Exactly.
Okay. So then hopping into the Q&A.
Sure.
I do have a couple of questions that I had dropped from my Instagram, and I also pulled a couple from a forum that I found.
Okay.
So first question is, how can we optimize neuroplasticity in ketamine treatments?
So I think there's a few things that we can look at, right? Ketamine treatment is usually part of a bigger picture, of a bigger treatment. So when we do ketamine therapy, we always have to look at the patients and see what other things they might need. And, you know, sometimes these patients can benefit from, you know, nutrition, micronutrients, peptides, and other options that can really enhance response, right? Because ketamine is going to generate a really good response, but what do we do after, right? How do we support that long term? So I think that's really the key there. To really make sure that we're maximizing the benefits of ketamine with all the other treatment options that we can.
Okay, yeah, which is why a really flawless protocol
Yeah.
would be beneficial in like integration coaching and things like that.
100%. And that's also very important when you're doing ketamine therapy and what you guys do. I mean, when you are able to integrate coaching and even during the ketamine infusion, even some guided support there, right? So we're helping the patients beyond what just the ketamine drip would.
Yeah,
Yeah.
yeah, okay. All right, next question is, what is the difference between large doses of ketamine infusions and microdosing ketamine when it does come to treating anxiety and depression?
It's a huge difference. The large doses, which are the ones used usually in surgery, the OR, they are really meant to produce a strong dissociative response.
Okay.
And just, in simple terms, patients are totally out of it, right? And obviously they're added to other anesthetics, right, to produce anesthesia and the effects that are desired for the surgery. In lower doses, patients are much more aware. I mean, yes, they can feel a little drowsy. Yes, they can feel a little dissociative, but it's usually much more reasonable, tolerable, and they are awake. They're not heavily sedated. And also in terms of side effects, I mean, again, when you go into the higher doses, you could have respiratory depression, you could have hypertension, altered responses, whereas in the lower doses, it's very manageable. Sometimes you might have some GI symptoms, nausea.
Yeah.
Some patients might just, especially elderly patients, older patients might feel a little anxious if they feel they're not in control. That can happen.
Mhm.
But again, very mild side effects compared to the higher doses.
Okay. And then when you're talking about treatments, if you were to do the microdosing, obviously you need to do it more frequently for a longer amount of time, or
So here's the thing, when we look at, the studies and our clinical experience with the low dose ketamine, you start seeing that after the first infusion, you can usually get a few days of improvement.
Yeah.
Symptom improvement. And that can go anywhere from 3 to 7 days, depending on when you do multiple infusions. And say, for example, if you time them like twice a week or every week for 2-3 months or whatever, when you do that on a recurring basis, what you find is that the effects are cumulative and are long, so you start initially, maybe it lasted for 3 days. After a few infusions, that effect is lasting a week, 2 weeks. So the whole idea of ketamine therapy is to be able to take the patient from that point where they need it to the point where they don't longer need it. Right? That's the idea. And along the way, we do all the other interventions, the coaching and everything else to help them go through.
Yeah, that's what I love about ketamine is the fact that a lot of people who do have anxiety or depression are put on SSRIs and things like that, that first of all are only about 40% accurate or effective.
Yeah.
And also it's something that takes weeks to have the effects really start kicking in, and you have to take it every single day.
Right.
You're now dependent on it.
Right. And that's really, that is really the power of the low dose ketamine, where you can have immediate response in some patients, like immediate response. And it can be, long lasting response, even sometimes with just one infusion. I mean, I've treated patients with certain types of chronic pain. And even after one infusion, their pain has almost gone. It can be very dramatic for some patients.
Yeah.
So.
Yeah, we had a woman at the first retreat who experienced a lot of chronic pain, and she was like, it's just gone.
Yeah.
It's just gone.
We've had that a lot.
So what are some ways in which we can extend the benefits? I know we've talked about the integration, obviously the repetition of that.
Sure.
Is there anything else that is kind of your golden ticket to maximizing the
benefits? I mean, there's a few things that we can look at here. One of them is, for some patients, in between the IVs and the infusions, they may benefit from sublingual or intranasal ketamine.
Oh yeah.
So that's an option. And again, especially in the first, few months or so. In addition to that, I just really think that you need to balance everything else. I mean, I'm a big fan of just restorative medicine. You look at your hormone deficiencies, you look at your nutrient deficiencies, you look at your toxicity buildup, and when you start really balancing everything out, the body responds. I'm just a big fan of that. So I see ketamine as a way to facilitate that process and to really alleviate a lot of the suffering that some of these patients have endured for many years. Yeah,
that's a great response. Okay, so how can we communicate to families or others around us when we're going through ketamine treatments to kind of let them in on what's going on, but like also have the space and the time to really like reflect and pull everything you can from it?
I mean, I think the most important point here is because for some, like like you said, some family members, for some people, ketamine might still carry a stigma. And I might be like, oh, this is an illegal drug, it's being used. Matthew Perry, died from it, et cetera, et cetera. So I think the first thing is to be knowledgeable about the fact that this treatment has been, it's published. We know that there's good clinical data on the effects of ketamine. And really just educating family members as to why this is happening, why we're doing this. And, sometimes I've had cases where family members are connected with therapists, and coaches them, and they can have that talk and they can better understand what this person is going through and just really support them in that process.
Yeah, that's beautiful. Okay, so this individual said, I have PTSD, anxiety, and depression, and this treatment is helping so much, but every time I do it, I have an insane fear that I'm dying.
Yeah.
I know it sounds really intense, but is there any sort of risk of stroke, heart attack, or are other people also experiencing this as well?
That's a great question. The clinical studies have been, have shown a really good safety profile for ketamine, especially in the low doses.
Okay.
So I have not seen any increased risk of cardiovascular events with low dose ketamine. And in my clinic, I have not observed that either. So I think, he should be reassured that that is not the issue. Now, having said that, I think that maybe in his particular scenario, maybe it would benefit if the environment is built differently around him. So, it's not only the actual infusion, but the environment in which you are receiving the infusion. You want a really calm space. You want a space that can, exude support, safety. You just want to feel that you can do this in a safe manner. So again, I don't know the particular case, but it might be that where he's receiving it, it's just not, those elements are not there and they're just activating that fear.
Yeah, especially if you already have anxiety or PTSD.
Right.
A little bit more anxious. You really
trigger. Yeah.
Exactly.
Yeah.
That's one of the reasons that I love the fact that you guys come out to the retreat space over in Ceiba, because it's a stunning area, first of all.
Beautiful.
And everybody gets to do it in the comfort of their queen suite.
Yep. It's perfect. I mean, it's really the perfect environment to do this sort of therapy because you're there with nature.
Yeah.
Better place to be than just connected with nature. Yeah. And again, you're in your environment, you're in a safe place, and you're being monitored. So.
Yeah. And us coaches and facilitators are there.
You guys are there.
Yeah, I have a 3P process. It's pray, poke, propagate, right? So it's like we sit, we set our intentions. I'm there with you. Like that's how it is. And I love the fact that your medical staff was very attentive to everybody's needs. Yep. It was really impressive. Right. Okay, next question. I've indulged in recreational use before and didn't really have any benefits in doing so besides getting high. The research that I've read about people using it medicinally claim that it's good for depression, anxiety, and rewriting your code. Yeah. But I've only ever felt that from things like LSD or psilocybin. So how is it that ketamine has gone from rave drug to a medical breakthrough?
I mean, again, I think that person might be a little misinformed because ketamine was always a drug, an FDA-approved drug. It was just being used in a different scenario, right? In the OR, exactly. Yeah. So it's not that it went from rave drug to medicine. It was always part of medicine. We just throughout the years we figured out or learned that changing the dose made it more therapeutically active for other conditions. So I think it's really about understanding that process. And I have patients that have used it before, legally or just through the rave scene or whatnot, but it's totally different when you're doing it in a controlled, safe environment for therapeutic purposes. So.
Yeah. And from personal experience, having done it in a clinical experience, I can't quite understand why people would want to do it in a rave setting.
Exactly.
It doesn't make sense to me.
It doesn't make any sense.
No, all I wanted to do was roll over and take a nap. That's the kind of mood I was in. So I think that's a really appropriate answer. Okay, so what is the benefit to doing ketamine in the retreat space versus in a clinic or at home or using the online services that ship it to you?
I'm probably going to say that the added benefit of the retreat space is just really you have probably an optimal environment because obviously in the clinic, it's a great place and the patients feel safe, they're being monitored. but it's still a clinic, right? So
Yeah.
there's still that component there where, you know, it's a medical clinic, whereas I guess when you're at that safe space, you know, in the retreat, you can really let yourself go, you know, you can really just connect with nature, connect with everything else. And that connection can, you know, potentially have other therapeutic benefits on its own. So you're combining two things in a really nice way.
Yeah, I like that. Okay, so when it comes to the retreat,
Yeah.
a lot of the things that we focus on are the transformations of self-perception and identity. So when it comes to ketamine and all of the work that it's doing, it's more so about the cascade, and we've talked about that, right? So you'll see that transformation continuing to happen.
Right.
Where do you think it holds a space in the personal development world or
No.
biohacking world?
No. I think, I mean, honestly, because of what it can do, neurocognitively, you can say that. I think ketamine can, for some people, not only help them with their disease states, but really enhance their connections and open other doors. And you know, and we're seeing more and more ketamine IV, you know, those ketamine being used therapeutically, but not necessarily associated to depression or to anxiety. Just people that want to be able to connect more. People that maybe even you know, I've even had cases where the patients come in, right, and they're doing the ketamine for anxiety, depression, but they also tell me that their creative capacity has improved.
Yeah,
They're
I
more
felt
creative.
that.
You felt that, right?
I literally remember saying that it felt like my imagination was unlocked.
Exactly. So there we can see, you know, going, and that's really exciting, going from just treating certain diseases to really enhancing wellness and opening other doors.
Yeah, I would agree. I would agree. Okay, so let me just read this quick.
Sure.
Okay, so when it comes to breaking free from limiting beliefs and things like that as well, I know the research is really new, it's very fresh, but what is your hypothesis in what's kind of going on as far as beliefs go? And I've been reading a little bit about like the default mode network and how that's being restructured potentially.
Yeah. I mean, we're going deep with that one.
Yeah.
We're going deep with that one. I think the world is changing dramatically, and you know, again, for many years, civilization, humanity has lived under a really particularly structured concept, which I think limits us big time.
Yeah.
And you know, definitely there's an awakening happening. There's an awakening happening, and when that process gets into play, it's like a snowball effect. You know, you start seeing that once people start opening up their minds and all that, you start identifying all these other therapeutic tools that can help that process. So I think that's why we're seeing, you know, so many changes with ketamine, psychedelic medicine in general, psilocybin, and you know, and obviously on a spiritual level, I think a lot of things are happening too. So it just all comes together. You know, that's just, it's hard to explain. It's just happening.
Yeah. Do you feel like that's why media is maybe targeting some of these psychedelic?
Probably. I mean, probably when you know, a lot of times in health and medicine, it might not be in the best interest of some groups to really have people heal, unfortunately, right? So, I mean, so when you have things that are really helping the masses, helping people, not everyone's going to be happy about that. And that's why we can see some of the things that are happening.
That makes sense. Well, those were all of the questions that we had.
Awesome.
Do you have anything else that you want to plug for people?
Yeah. So, I mean, two things. One, just one more side note on ketamine. I think a lot of patients are potential candidates. A lot of people are potential patients for ketamine therapy.
Yeah, this is good.
And you know, it's more about becoming more aware of what this entails and why they can benefit. So I think education, what we're doing right now is really good, just raising awareness.
Yeah.
So that's one thing. The second thing is obviously I just plug in, you know, my clinic here in San Juan. Anyone that wants to come over, we're all invited, and we have a really good offering of integrative services, as well as ketamine, IV nutrition, the hormones, regenerative medicine, hyperbarics and such, so. It all forms part of the greater healing, so that's good. And then obviously I can't wait for the retreat.
Yeah.
That's the other thing. Retreat is gonna be amazing.
Yeah.
And you know, the people that last time it was great, the feedback was wonderful, and I think it's gonna be the same or better this time around.
I'm voting for better.
Better, exactly.
Better every single time.
I agree. So looking forward to it.
Yeah, the next retreat is in November, the 10th through the 16th, right after hurricane season,
Yeah.
which is a blessing to experience out here.
Totally.
But yeah, thank you, Dr.
No,
Martinez,
thank you.
for sharing your expertise.
It's been a fun talk. We need to do this more. So,
Yeah, I'm really excited. Amazing. Well, you guys have heard it. There's a lot happening in the world of psychedelic medicine, and it's really cool to see how it takes place in the regenerative medicine space as well, personal development, healing things that we haven't really been able to heal before.
Right.
And so I just highly encourage you guys to do your own research and connect with individuals who have taken part in it, or find an expert and use them as resources to educate yourself. And, you know, I mean, like you said, there's a lot of people who could really benefit from it and be really good candidates in it. So
I couldn't have said it better.
yeah, if you're curious, do the digging, find the resources. I'm available for it. Dr. Martinez is incredible. Do your clinics in Florida also?
Yeah, so I have clinics in Orlando and Miami. We
Okay.
can probably just add that info there for people that are interested in the state of Florida, and
Yeah.
come on over.
Yeah.
No.
Yay. Okay. Well, thank you very much.
Thank you.
And we'll see you guys in the next episode.
That was really good.
Not bad,
Not
huh?
bad at all, I think.